Why is vitamin D so important, and why do a lot of people need to supplement? Again, this is not medical advice, and always check with your doctor before you take vitamins, minerals, or any type of supplement. So vitamin D3 is actually super important for our immunity. It helps with depression. It helps with to give us strong bones. So it plays a lot of different roles, and it actually acts like a hormone. So it's important in balancing other hormones in the body as well. So it's very, very important. We saw the significance of vitamin D3 during the COVID, when we recognized that people that were low in vitamin D did not do as well with viruses and sickness, and they don't heal as fast. There are also studies that show that women who are deficient in vitamin D are also up to 400 times more likely to get cancer. So, and we've known this for decades. There are decades of research that show how exponentially important vitamin D3 is to the body, and the role that it plays in immunity and overall health. So if you are supplementing with vitamin D, always, again, check with your doctor first, but get your levels checked before you start supplementing. It's not a blanket to where everybody can take the same amount. Our food, sometimes that's not a great source, because it's not always, we don't have other things present in the soil that we need to absorb. So get your levels checked. It's a cheap test you can get on Amazon. If you haven't had it, if you have insurance that won't pay for it, it's not really an expensive test at LabCorp either. If you want to go to some different facilities and get that blood work done, you're going to check your levels. And what you're going to want to do is, when you start supplementing, check your level. And then remember, it takes, for most people, 3 weeks to convert vitamin D3 into the active form of vitamin D3 that our body can actually use. So if you test and then you check and you are low, and then you supplement and you test again in 2 weeks, you may not have had time to convert that into the active form. So wait at least 3 weeks before you check again. Then check it again every like in a month. And if your levels are good, just check it every 3 months to make sure you're keeping your levels at optimum. Remember too, with vitamin D3, that which helps with bones, and we want to take that calcium to the bones. We need K2 to do that. So if you don't eat a lot of leafy greens and things that are high in K2, you may want to supplement and add K2 to your D3 to make sure you're taking that calcium to the bone and it doesn't end up in the arteries